my name is Sarah Michelson. I'm Chief of Staff at the Oregon Early Learning Division. I'm here today to walk you through the professional development guidelines of our health and safety guidelines. On August 14th, 2020, we issued new guidelines for operating childcare and other early education programs during the COVID-19 pandemic. This is part of a series of videos to help you understand and implement our new guidance. Please start by watching the introduction video from Miriam Calderon, our Early Learning System Director, if you haven't already. This introduction video describes the purposes of the guidelines and the process we use to develop it. After you watch that, you should watch the overview video. This describes who the guidelines apply to and the process you need to follow to legally operate a childcare program during this time. We continue to operate under emergency childcare or the early emergency childcare system, requiring licensed childcare providers and others to apply and be approved to operate as ECC. This video, as I said, will go over Section 13, Professional Development. This section is about what we as the Early Learning Division and our Office of Child Care is requiring of you and your staff for professional development during this time. So let's go on to Section 13. So as you know, the adults within a childcare program are the single most important ingredient to healthy and safe childcare, and we want to make sure you and those that you work with have the right knowledge and skills necessary to operate under these guidelines during this time. So let's look at what the requirements for this section are. So first, CPR training will continue to be allowed to be virtual for those that are seeking recertification. If you're unsure of where to find online CPR training, please contact your local childcare resource and referral agency or reach out to your licensing specialist for help. Programs with staff also must ensure that those staff know how to access professional development and training and have the resources to do so. So what does this mean? This means making sure your staff have the internet, a computer, or other device are supporting them in accessing these things. Again, our child care resource and referral agency can be a support to find these resources if you or your staff need help. Also note that we are discouraging in-person training. Many people have asked us why being in person for childcare is safe if being in person for training isn't. The simple answer is, it's not that being around others isn't safe, it's about the number of people you're around or exposed to. The discouraging of in-person training is to acknowledge that we want to help support you to reduce the number of group gatherings you attend. There are some clear characteristics in the guidelines for in-person training if that is something that you are going to do, including trainings that include staff all from one site and that where you're socially distanced during training. Again, reading the section that's 13.4 of this section closely to see whether this is something that is possible. But again, we're discouraging in-person training to limit that person-to-person contact. Finally, we're requiring that all staff know these guidelines and that they are supported to understand them through training or onboarding. These guidelines will only work if you and your employees can implement them, and we know that training is a key ingredient to this. We're continuing to update our approaches, such as these videos, and will continue to ongoing throughout this pandemic. But in the meantime, we really encourage you to make sure that your staff understand all parts of these guidelines, and please reach out to us if you feel like you need support in doing so. Be sure also to check out the recommendation section, which is on the following page in this section, for other ideas on how to stay up to date on best practice, how to support staff in accessing professional development, and to ensure that you're recognizing that mental health and self-care are critical components for you, your staff, families, and children to be focusing on during this time, and something we all need to build our knowledge on. That is it for this section. If you have questions apart from what we've went over on this video, please go ahead and reach out to your licensing specialist, to the Office of Child Care in general, or to your local child care resource and referral. Stay healthy and stay safe. Thank you.